Good morning, ma'am and sir. I am Nurse Leona. How can I help you?
I need your help. My father has been fatigued and weak for the last 4 weeks, and the color of his stool is maroon.
Aside from those, ma'am, has he experienced fever, coughs, and colds the past few days or weeks?
No.
Okay, ma'am. Sir, what is your name?
My name is Juan.
Sir, I am Nurse Leona. I'll be taking your vital signs first. Has he been like this for the past few days, weeks, or months?
I think so because he was recently admitted to the Bicol Medical Center because of a recent pulmonary infection.
Does the patient have any past medical history aside from this?
Yes, aside from that, he also has a history of hypertension, diabetes, as well as hematuria. He also had a arteriovenous malformation as well as mild aortic stenosis.
What's the complete name of the patient, ma'am?
His name is Juan de la Cruz.
Who is his physician?
It's Dr. Angeles.
Thank you for this information, ma'am. I'll be sure to relay this to the nurse in charge. Please wait for a moment.
Mhm. Hello, good morning.
Good morning. This is Nurse Leona from USI Mother's Seton Hospital Triage. I am here to ask for information regarding one of your patients. Patient's name is Mr. Juan de la Cruz under Dr. Angeles. The patient is currently here at USI Health Services Department. You were informed that the patient was recently admitted to your institution due to a pulmonary infection. May we ask for pertinent health information data gathering during your stay at your hospital? Thank you.
Okay, kindly wait for a moment, please. Mm, for Angeles, Juan de la Cruz. Okay. I already have his health information with me. I will be sending the file to your email, okay? Okay.
Alright. Thank you so much for your help.
Okay, thank you. Thank you very much.
Good morning. Endorsing Mr. De La Cruz, Juan from Bicol Medical Center, 78 years old, male under Dr. Angeles with a recent diagnosis of pulmonary infection, atrial fibrillation, and non-ischemic cardiomyopathy. Chief complaint, fatigue and weakness, and maroon-colored stool for 4 weeks with past medical history of hypertension, type 2 diabetes mellitus, mild aortic stenosis, hematuria, and AVM. Initial vital signs were taken and recorded as follows: BP of 140/90, PR of 88, temp 37.6 Celsius, RR 23, autosat 96%.
Anything else to add regarding the patient's condition?
I have attached and sent the patient's health record, which contains the medication list, lab values, radiologic data, operating record of the patient upon admission to the hospital in your system's email.
That would be noted, ma'am. Thank you. morning, ma'am and sir. I am Nurse Nori of the Guadalupe unit. I am here to orient you first of our facilities and of our different services. So, we have 3 units, the Peña Francia unit, the Our Lady of Nations unit, and the Guadalupe unit. The patient, Mr. De La Cruz, will be assigned to room 228 of the Guadalupe unit under the care and supervision of Dr. Angeles along with us nurses. Now, let me lead you to your room. So, this is the room. On this side, you have the restroom. You can make use of the cabinets during your stay here to keep your clothes and your other belongings. In case of emergencies, or if you need urgent help or assistance, kindly press this button. This button will notify us and nurses on the station regarding your concern.
Thank you so much.
Thank you.
Good morning, Dr. Angeles. This is Nurse Nori from the Guadalupe unit of USI Mother Seton. I would like to inform you that one of your patients is currently admitted in our unit.
Good morning, this is Dr. Angeles. May I know who the patient is?
Yes, Doc. He is Mr. Juan de la Cruz, 78 years old. He was recently admitted to Pbl Medical Center due to pulmonary infection.
Right, I remember him. How is he doing right now?
The patient came with a chief complaint of fatigue, weakness, and the patient has been defecating maroon-colored stools.
Okay, would it be possible for me to have a look at the patient via video call since I'm currently out of town right now?
Sure, Doc. Please wait for a while. Sir, Dr. Angeles wants to speak with you.
Morning, sir. How are you feeling right now?
Morning, Doc. I am still not feeling well right now, and I feel so tired, and my stools have not been looking that well. I feel that there's something wrong going on in my body.
How long have you been experiencing this?
It's been around 4 weeks. Yes, 4 weeks, Doc.
Have you been taking your medications on time?
Yes, Doc.
Very well then. I will be requesting for you to undergo several tests so we could appropriately assess your current condition. Will it be alright?
Yes, Doc.
Okay then, so since I am currently out of town right now, I have Dr. Reyes to look out for you while I'm gone, okay?
Okay, Doc. Thank you.
You're welcome. May I speak with the nurse, please?
Good morning, Dr. Angeles. This is Nurse Nori from the Guadalupe unit.
Nurse, so I'll have the patient to run for some tests and kindly inform me once the results are out. The forms, I will be sending it to you later, okay? Thank you.
Okay, thank you. Good morning. This is Nurse Nori from Guadalupe unit. Dr. Angeles is requesting patient Mr. De La Cruz of 228 for a stat echocardiogram. I'll be sending his information later.
Okay, kindly make sure to attach the request form and the consent form. I'll have it here ready and notify you when to send the patient in here.
Okay, thank you. Good morning. This is Nurse Nori from Guadalupe unit. Dr. Angeles is requesting patient Mr. De La Cruz of 228 to undergo several abdominal tests, gastrointestinal endoscopy, colonoscopy, and video capsule endoscopy exam. Kindly let me know wherever you are available.
Okay, Kindly show us the request form and the consent form first, followed by the patient chart. I'll give you heads up once we're ready.
Okay, thank you. Good morning. This is Nurse Nori from Guadalupe Unit. We would like to request for the presence of a medtech to get patient De La Cruz room 228 for CBC test. 28.
Yes, ma'am, this is noted. Can you show us the request form first? Then afterwards, we'll be sending one of our staff there. Yes, ma'am, thank you.
Okay, thank you.
Hi, this is from Diagnostic Center. We would like to inform you that the result from the CBC of patient De La Cruz from 2 to 8 is already posted in his record. Thank you.
Okay, thank you.
I noticed that upon admission, his hemoglobin level was around 4.1, and now, on his third day, it became 3.1. Kindly monitor the patient's vital signs input and output, okay? And note for any signs of bleeding.
Okay, Doc. Thank you. Oh, by the way, Doc, here are the results of the test.
Based on the results here presented in your monitor, his GI endoscopy results is normal. That's good. However, here in his colonoscopy results, it has shown that there is a transverse colon polyp, but no active signs of bleeding. Okay, we have to manage this one. And as for his echocardiogram, on the next page, the result shows an improvement. It used to be on the 10% side, but now it's on the 40% fraction ventricular ejection in the left side. Continue to monitor the patient closely, okay? Thank you.
Yes, Doc.
Good morning, nurse. How is patient room 228?
Doc, there was an improvement in his hemoglobin level. It is currently 5.1. He does not show any symptoms from his anemia as well.
Okay, that's good to hear. The patient may now then go home. By the way, kindly include in the patient's discharge plan the continuation of his medications, except Xarelto, okay?
Noted, Doc. Hello, sir. Are you feeling better?
Yes, so far I'm feeling better.
Good to know, sir. Well, you have shown great improvements for the past few days, and I am here to inform you that you may now go home as per advice of Dr. Angeles.
Oh, thank God, you're finally home.
Wow, so that's good to hear. So I will ask my companion now to prepare all the paperwork and also to settle my bills so that I can go home as soon as possible.
Yes, sir, that's a great idea. But before that, I would be instructing you on a few things to remember, okay? Before you left, sir and ma'am, I would like to remind you that you have to take 1.7 liters of fluid a day. Also, continue your medication, aspirin and iron sulfate, and also vitamin B12. Please avoid xylitol to prevent your eye bleeding. And also, in able to not forget your medication, you can write it down in a notebook, and every time you take your medication, you can cross it out. Also, I advise you, sir, to have 7 to 9 hours of complete bed rest and also to make your environment pleasant for relaxation. And lastly, for your nutrition, you may eat high in iron. This includes meat, shellfish, eggs, beans, and leafy vegetables. That would be all, sir. And ma'am, have a good day.